it is a pleasure to be here today. I'm devastated. I'm not down in sunny Devon to getting the chance to escape London and have a cream tea. I won't go into the I know all about the argument of whether it's cream or jam first, and I'm staying neutral on that as an Australian. But yeah, so it's really good to be here today. And as some of you may know, we explicitly mentioned environmental sustainability for the first time in our strategy document that came out back in 2021, where we talked about how when we look at how effectively a service works with others and in partnership with local communities, that environmental sustainability is going to be increasingly be a part of that. But we mentioned it as well in our state of care in recent years too, that one of the greatest challenges that's currently facing health and social care that we have been identifying through our work is inequalities in care and the climate crisis that we are facing, despite the way this summer is going. The climate crisis does further, it widens the existing health inequalities that there are between and within populations, and it threatens to undo the last 50 years of progress we've been making worldwide in relation to global health and poverty reduction. So as part of that, we looked at how we could include that in our assessment framework. So we will not be looking at this in our first year of assessments under the new single assessment framework. I'm sure you're all well versed with the new framework now, and hopefully you had the opportunity to comment on that. And so it is being considered, environmental sustainability is being looked at in NHS trusts at a trust level, and it's also part of our ICS assessments as well, which are currently on hold. But yeah, I see that as one of the main points I need to get across today, that we are not currently looking at it in adult social care. That is not switched on yet, and we will ensure that you get plenty of notice when that will be switched on. But we know it's an area that people are interested in and keen to be prepared for when CQC contacts them about an assessment. So moving on, I've been doing a little bit of engagement around this over the last few months. I met Lorna back at the start of the year, I think it was, but we've been trying to talk to providers about how they feel about this being in the single assessment framework, whether it's something that's on their radar at all. And you as providers are really aware of it. You're really interested in it. You've talked to me about your frustration at the stance the government or the former government had taken on this, and there's a lot of interest in what the new government is going to be doing on it going forward. You've been telling me that you want to know more about what CQC will be looking for, what good will look like. There's a fear across the sector around there being significant costs involved in that, and hopefully I can reassure you that there doesn't need to be. And there's a lot of uncertainty about the resources that are available, particularly around what training there might be. We've been engaging with the other sectors as well, and I've been surprised at the lack of pushback that there has been on this so far. Every meeting I go to, I expect all of you to be saying to me, no, we don't have time for this. We've got far more pressing matters to be considering. We don't have the staff, we don't have the capacity, we don't have the resource. And I haven't been getting that, which has surprised me. And I've been having these conversations for a few years now. But when we've talked to the other sectors as well, they've said to us that they are glad it's been added to the framework because they see that CQC can help shape the conversation around this, and CQC is a key way of driving the agenda forward on this. But when CQC is trying to drive behaviour on this, that they'd like us to be enablers for improvement and being a support rather than being a barrier. There are enough barriers in this space already in relation to funding, knowledge and resource. All sectors are really keen to be hearing more about good practice on this. It's seems to be universally viewed as being completely inconsistent on this. The system isn't particularly joined up in terms of the support that's available, the funding, or engaging with service providers at all. I know the independent health sector feels very much like the adult social care sector does, that they don't have anywhere near the sort of funding and support that the NHS gets on it. But that this is an area that younger staff in particular are very interested in, and doing more work on this actually helps to increase staff morale. So it would be great to hear from some of you on whether you are finding that in your services as well. But something else that we've been hearing is that, ICSs and NHS trusts have to have green plans, which is not a requirement in the adult social care sector at all, but they don't often consult with their partners in the community on this, and often don't provide any feedback or give any. There is very little follow-up on this as well. So we'd be interested in hearing about that from you, if that's what your experience is in your liaisons with your ICS or with trusts in the area, because it's only going to keep on increasing broadly, and I feel that this is an area where adult social care could really lead by example on collaboration and co-production. So I think that's something that this sector is particularly good at. Moving on to the next slide. So to briefly talk you through how sustainability is appearing in the single assessment framework, it has always been in there to a large extent under the SAFE and well-led key questions, but the focus has always been generally on reactive work, looking at safe environments, continuity of care, that sort of thing. Where it differs in the new single assessment framework is that there is a specific question now under well-led, which is specifically titled environmental sustainability, and it is focusing more on the mitigation or the proactive side of things more. So I think the next slide is the equality statement. So we would be looking to see that providers, so the we in this question is the statement is providers understand any negative impact of our activities on the environment, and we strive to make a positive contribution in reducing it and support people to do the same. Potential subtopics on this subject. These are the subtopics that we're trying out in NHS trusts at the moment. So we're looking at what sort of work has been done on staff education and awareness, on carbon reduction, health promotion and prevention as well. I can see, I will. I'm not monitoring the comments right now, but I will have a look at those when I just do a few more slides, if that's okay. But if someone has a burning question they really want to ask, pop your hand up, and I think would be able to see that, or someone speak up if you like. We talk about estates and facilities as well. I went to an NHS waste management conference a couple of weeks ago, and they said to me, "Oh, I groaned when I saw the word recycling on there. That's just so basic." But sometimes it's the little things we do that, can make that difference. And we know that something that's more pertinent in the bigger cities, but we know that thousands of lives can be saved every year from improving air quality. I thought it would be worth mentioning here, other sectors do have a few more specific legal requirements at the moment than adult social care does, and I just thought it would be worth briefly flagging those here. So trusts and integrated care systems are required to have a green plan and to have at a board level a net zero lead. Integrated care boards and their partners, they have to develop 5-year joint forward plans with their systems partner. So you should all be getting asked to contribute to those. They do have duties to contribute towards net zero targets as well. And there are business continuity plans that are a requirement, I think, for most of those too. So if they have not been shared with you by your local partners, I'd suggest having a look on their websites and asking them for it, because I've worked in policy for adult social care for about 10 years now, and I know that if I come along and give a presentation to you that just has NHS stuff on a slide, you will say, well, to use an Australian phrase, bugger off. You know, that's not good enough. We don't need that in adult social care. You know, and I fully understand where you're coming from with that, but I would humbly suggest there's some good stuff on the Greener NHS Works website around developing a greener plan, and if you would consider having a look at that, you might get some great ideas from it. That it I know it will have come from the NHS. I promise I won't tell them I'm telling you this, but there's lots of stuff in there that you could perhaps draw from that could be useful for you in your services. And please don't hate me for saying that. So in the quality statement, as you will know, we have 6 defined evidence categories. What we will be focusing on, or what we are currently focusing on in the trust inspections is 3 of those evidence categories. It's the feedback from staff and leaders, feedback from partners and processors. But we are going to be monitoring that over the coming months and seeing if that is still appropriate for adult social care when the time comes for that quality statement to be turned on. If you feedback to us as well that you know your residents and people who use your services want to be contributing to that as well, we'd look forward to hearing about it, and we can certainly help that to shape the work we do in that space as well. I thought it might be useful to think about some of the things that might be useful in your preparation for this quality statement. So, are you engaging with your residents and the people using your services? Are they aware of what you're doing in this space? Are they able to contribute to that? Do they feel comfortable raising ideas with you? And same for staff as well. As staff being encouraged and enabled to consider sustainable practices. I have a fantastic example about a community health service that switched over to e-bikes, and there's a video around it, and I didn't want to include it in this presentation because I thought, no, it's an NHS presentation, they won't like that. But they had the members of staff who used the bikes on it who said, we aren't stuck in traffic jams anymore, and we've lost a little bit of weight, and we're out in the fresh air, and it's great. We've really enjoyed this. There's things to consider around medicines use and reducing waste in that way. I've got a slide further on that touches on this briefly in relation to asthma. But so it's considering the co-benefits for the communities, really working with the local authorities, working with the third sector, that sort of thing, understanding where the biggest wins are and seeing if you can have a plan for that. But the key thing to remember that is if a process is safe and sustainable, then it is unlikely to be breaching. I'm so sorry. I've ruined my
Okay, I think you're on 11, I think, weren't you? Yeah.
Yep, slide 11, yeah. I was just saying that if a slide is safe and sustainable, it is unlikely to put you in breach of our regulations. This is the example I just mentioned about asthma. So some asthma inhalers have a very large carbon footprint, and the standard one, which is the picture at the sort of higher up on the screen there, it contains about 100 2-puff doses, and its carbon footprint is the equivalent of a car traveling 175 miles, whereas some of the newer asthma inhalers that are available are the equivalent of traveling about 4 miles. People, anecdotally, what I've heard is that the people who are using them haven't noticed a difference between using the 2 different types, but they like knowing that they have that choice.
So, April, how would you evidence that decision that's been made, that it is a kind of an eco decision as much as a patient choice one? How would you recommend providers evidence that change?
A good question. I think perhaps possibly as part of the medicines optimization, you could capture if that choice is being offered to residents, how they found using it. If we can ask residents as part of our assessment if they are using the new types and if they found that okay.
And it's evidencing it within that quality statement, I suppose, as well, isn't it? To make sure that as well as the medicine optimization,
Yes.
it's also then linking to that. That makes sense.
Can I just ask? Sorry, I've just apologies for being late coming in. What happens if you use a spacer? What effect does that have? Do you know, in miles?
I'm not sure, but can I come back to you on that question? Would that be okay?
Because most of our residents use spacers, and I just wondered what the difference would be.
I went to a meeting quite recently where they were someone had actually developed a fully recyclable spacer, which was very popular. But what I think I probably would prefer to do on this one is I'll speak to a colleague who is an expert on this specific question, and I'll come back to you if that's okay. But if you pop your email into the comments section, I will come back to you on that.
Thank you.
Okay. I always expect at least one question in any presentation that I will not be able to answer. It's always the way. And I'm conscious I'm running really close to time, aren't I, Lorna? I'll speed it up a bit. This slide is absolutely draft, and I just wanted to talk briefly about what good could look like in adult social care. That this is not in any way an approved set of bullet points on what good could look like. This is just to give you a flavour of the sort of thing that we would be looking for. So around leadership developing a commitment to environmental sustainability. So, you're already thinking about it in terms of governance and support. That could be a named staff member, specifically considering it if there's capacity for it. But thinking about minimising the adverse impact in a more proactive way and helping to make your workforce aware. I know that Skills for Care have got their 15 recommendations, which are very, very comprehensive, and we would never expect a provider to be meeting 15 different recommendations like this in the first year of it coming out. I know when I talked with Lorna about prepping for this session, and she sort of said, what would good look like in year 1 and what would good look like in year 2? And I'm a little bit reluctant to give too much detail on that yet, because we don't know yet, and we want that very much to be shaped by what you tell us. So I think I've got a slide coming up that sort of says, how can we work with you on this? What does good look like for you? I want to engage with all of you to hear more about that. So I feel I would not be comfortable saying this is absolutely what good would look like in year 2 when we haven't need to be talking to you more about that. Oh, so here are my slides. Here are my questions rather. So how can we work with you? And what does good look like for adult social care? If you have examples of this, I would love to receive them or hear about them. I did also want to quickly mention the new Labor government, because it's been a big change, hasn't it? And when I went through the manifesto, it didn't feel there was much in there on health and social care. It was very fuel and energy focused, and it was one of their 5 key missions. But when you sort of went further into the detail, there was very little in there around health and social care. So I'm watching that space. I'm not clear as well on exactly how it's going to be looked at across the different departments, because DEFRA specifically has ministers for the environment, but currently, from what I can see, every single minister has the word environment in their job title, and they haven't published any portfolios on that yet. And David Miliband is the Secretary of State with a specific remit for net zero, but that's a completely different department, and I do not know yet how that is all going to work together. But I'm very keen to. I'm going to be keeping a watching brief on that, and if we spot anything, we'll include that in our monthly bulletin. Also, I know that the Climate Change Committee are going to be publishing their 2024 UK progress report in 2 days' time. And I think, given how negative that was last year for the UK government, I suspect it's going to be quite heavy hitting as well. So it's a shame almost that we're meeting today rather than in 2 days' time. But anyway, I'm really conscious I'm running over time now. We have a whole heap of resources available for you here. There's links to all of those on that page. But shall I open up now to questions if there's still time for that? Stop talking at you.
Any questions, anybody? I think Marta's made a good point about her attempt to contact EDDC to suggest some collaborative working and training and facilities, and didn't get a great response. Marta, do you want to speak on that, or are you happy? I think the main thing, April, is that kind of evidencing, isn't it, that we seem to be doing for all of the new framework, and making sure that all those different categories and subtopics are covered. And I kind of applaud yours and Lorna's attempts to kind of bring environmental and sustainability into there, because I think a lot of us will be thinking about lots of other things in and amongst all of that. And it is quite, from what you've just said, it's quite easy to interweave that into some of the other bits of evidence that we're collecting anyway. Would that be right?
Mm-hmm. Yeah. When a couple of years ago, when we were looking at how it could be expanded in the assessment framework, most of you are already doing this when you're considering the continuity of care for flooding risks and heat waves already. And the UK HSA put out their guidance as well, and put out their alerts when there is a heat wave forecast, and they have guidance for managers as well. And there's increasing amount of academic research on this as well. So I know that there was a project called the Climate Care Project, which ran for about 5 years, specifically monitoring temperatures in care homes, and they got volunteer services from all across the country, and they specifically did have thermometers, where they spent a lot of time trying during COVID in lockdowns to persuade care home managers to consider joining this. But they compared things like rural settings versus urban settings, and whether a building was brand new or custom designed, or whether it was adapted. And some of the services within that were 15th century almshouses that had been converted versus brand new custom built adult social care services that often were so tightly they were so tightly built that often they trapped heat at times within the building. So there's a few publications coming out around that had some really interesting information in there around how staff felt, whether they felt like they were getting overheated in services, and how residents felt about it as well.
And I think that's before we even take into account the kind of very eclectic buildings that we all are housed in. Because some of us are in Georgian buildings and some of us are in lovely, newly made buildings. Lorna?
Yeah, I think you're right, April. I think actually a lot of managers and providers are doing things already, but they haven't actually had the time or space to sort of sit down and just say, actually, the fact we moved to LED bulbs, most people will be using LED, which is actually saving carbon. So there's lots of things I think people can do in terms of just compiling the things that they already do, and as part of that evidence for just their baseline. So, and it doesn't have to be, I think there's a fear of it's got to be a huge, big, change to the building, which is going to be enormously expensive. And actually, there's lots of smaller things and actions that can be taken, and broader things, not necessarily about decarbonisation. It might be about, looking at menus. It might be about food waste. It might be about making the garden, more pollinator friendly. There's lots of other things that can evidence actually we are on an environmental sustainability journey.
Yeah, absolutely.
So there are some, let me get rid of that hand. So there are some schemes that have opened this financial year in Devon, which I will put the links into the chat bar. So basically, if you are in East Devon, there is now a scheme run by East Devon District Council called the Carbon Action Programme. So you get basically some free advice and support, and you have to have gone through that in order to go for their grants programme, which will be launched in the autumn. That could be, it will be, I'm sure, a sort of match funding type thing, but it could be really useful if you're just at that brink of thinking about a more sizable investment and looking for some extra money towards it. If you're mid-Devon and Exeter, you come under a free business advice and support. This is all being delivered by a place Business Info Point. South Hams, West Devon and Teignbridge are also covered under a separate scheme. Tell me about it. I know it's complicated. And they've got different amount of grants. The South Hams one is open, but it's on a kind of competitive basis. I believe there's also free advice and support that you can sign up for regardless of the grant. So I post all of those links. As far as I'm aware, there isn't anything covering North Devon and Torwich yet. But I have put a request out to say, actually, this is because I would have expected it. But it may be that they didn't actually apply. There was some funding called the Shared Prosperity Fund that central government ran. That's funding the rest of it. Maybe they just didn't apply or didn't get it. The other thing, just to point out, there's a greener care guide on the website. Under the resources section, just have a look down at the bottom. It says click here for a greener care guide. That gives you lots of sort of ideas, looks at different areas such as, you know, buildings, energy, transport, chemicals. So it looks at simple things that you can do as well as things that are perhaps bigger projects. So you can have a look at that. Oh, an example, if you so if you don't want to have a look at the NHS website, Oakland Care, you may have heard a talk. Joanne Bulmer, CEO of Oakland Care, often talks about environmental sustainability. So they have very kindly put on their website very detailed statements about their commitment to sustainability and lots of how they are sort of setting out their ambitions and targets. So I've also got a link for that.
Thank you for all of your work on that, Lorna, because it does make a difference. And April, thank you for your time as well. That was really helpful and really interesting.
Thank you. I'll go
Thanks,
now, so
April.
you can talk about
Well,
it.
you're more than welcome to stay, but